morning. This is Dr. Goodman's office. This is Teddy speaking. How may I help you?
This is a sign language interpreted phone call. Oh, is Dr. Goodman not available? I was hoping to speak to him.
Good morning. Sorry, Dr. Goodman's not available right now. He's actually at the hospital doing some emergency surgery with another patient. Is there something I could help you with? I'm his medical assistant.
I think that'd be fine, sure. I was just wondering, a couple weeks back I got my blood work done, and my results came back saying that I had diabetes type 1. And I was just curious what my next step
Sure, I'd be happy to help you with that. First, I would need to verify your birth date and your name so that I can pull it up on our records.
My name is Emma Roberts, and my birthday is November 17th of,
I'm sorry, you said that was November. I didn't catch the last part.
November 17th of 1945.
Okay, November 17th, 1945. And would you mind spelling your last name again?
Roberts.
Okay, thank you. I've got you pulled up here on my screen. And how can I help you today? I have your records here right in front of me.
I just needed to know a couple things about my cholesterol. I had a couple questions. Could you help me with that?
Sure. I have several times here listed when you've had lab draws. Can you let me know when was the most recent time that you went to the lab and got your blood drawn?
Oh, that'd be last week.
Okay, was that towards the beginning of last week? Okay, because I had a couple dates here, but now I can see your most recent results. So I have some of your results, and I have a note here from Dr. Goodman saying that I can give you the results of your A1C blood work. The most recent A1C was 7.2.
A1C1? What is that?
I'm sorry?
A1C? What is that? I haven't heard that before.
Oh,
do you mind
yes, I can
explaining?
explain. So the A1C, remember when you had your blood drawn and the doctor said that he would check you again in 3 months to test the average blood sugar? That's what the A1C test result shows. It kind of takes all of your blood sugars for the last 3 months and averages it into a score. I don't know if you'll remember, but the first time you came in, your number was 10.0, and your most recent results show a decrease into 7.2.
Oh, okay. I'm a little foggy on the details, but I thought that the doctor was going to send me my results so I could look them over. Is that a possibility?
So you wanted a chart to look at to be able to compare your test results?
Yes, my previous.
Okay, I know Dr. Goodman has several handouts related to type 2 diabetes and how to monitor and understand your test results, and I'm sure he'd be happy to share that with you the next time that you come into the office.
Oh, okay. Thank you so much. I'd really appreciate that. And the doctor's going to be there for that, right?
Yes, we'll make a follow-up appointment for you to come back in and talk with Dr. Goodman about your results, and I'm sure he'd be interested to know how you're feeling, if you're experiencing any side effects, and what the next plan of action is related to the management of your diabetes.
Oh, okay. I would really appreciate that. I need to set up an appointment with him, huh? And then I have a couple questions that I'd like to ask.
Well, I can answer some general questions as far as particulars from your test results or your records. That's confidential information, and you would have to wait until your appointment with Dr. Goodman. But I'm happy to answer any general questions if possible.
Oh, okay, sure. I wrote a couple down. Let me see here. Lately, my tummy's been a little upset, and I've been feeling kind of nauseous. I think there's side effects. Are those going to get better at all?
So dizziness and nausea are quite normal with people who just began taking the medication that you're taking, which is from your records here, metformin. And normally those side effects will go away within 1 or 2 weeks. If the side effects persist, you can always come in and see Dr. Goodman and talk to him about perhaps changing the dosage or to another medication.
Oh, okay. Sure. All right. I have a couple other questions. I was wondering about my blood sugar. I'm not quite sure what I should do for management, and I have some concerns.
Often patients have a lot of concerns and questions at the beginning of starting a new medication, especially for controlling blood sugar. And Dr. Goodman has a lot that he can go over with you the next time you want to come in. And I am happy to transfer you to the front office. You want to go ahead and make your next appointment.
Okay, sure.
Sure,
But
go
I
ahead.
just have one last question. Do you know about the HLDL? Oh, you know what I'm talking about.
Oh,
I
are you
was just
talking
wondering
about
what
your
that-
cholesterol?
Yes, that.
Yeah, I do show here that the blood test was run on your cholesterol. However, I haven't been given authorization to discuss those results with you. So again, I can make a note and let Dr. Goodman know that when you come in, you'd like to talk about your blood sugar medication and also the results related to your cholesterol.
Okay, I will set up a meeting and make sure that I see him. Thank you so much for your time.
Sure, I'm happy to help you,
Appreciate
Mrs.
it.
Roberts, and I'll go ahead and transfer you to the front desk now so you can make your appointment.
Thank you so much. Bye-bye.